Esperança has been consistently communicating with our international partners since the outbreak began, causing us to adapt our programming abroad. Each of our partner organizations has been affected differently, given the level of severity and government guidelines in each country. As the pandemic progresses at different rates through each country, Esperança is responding to the unique needs that arise in each of our partner communities. Today, I would like to share an update on the different pandemic response programs taking place in each of our partner countries: Bolivia, Peru, Nicaragua, Mozambique, and Ecuador. Bolivians have been under strict orders to shelter in place since mid-March. This forced our partners to quickly shift gears and adapt programming. Our health classes transitioned to short videos and GIFs that are now shared with participants via WhatsApp. We have also sent additional funds to help support struggling rural families who have lost jobs and income. This project will deliver food packages containing staples like rice, flour, sugar, oatmeal, and oil to 770 families. 600 of these families have young children or people with disabilities. 120 are rural agricultural producers, and 50 are leaders from Esperança's Integral Health Project. Peru's pandemic has largely impacted urban areas, though we are beginning to see its effects on rural communities, as urban dwellers return to their areas of origin in an attempt to escape the high levels of cases in cities. We have adapted our programming to prepare rural communities for the inevitable arrival of COVID-19. For example, we are providing accurate, up-to-date information on the pandemic and best hygiene practices via radio programs to reach 20,000 rural families in their native language. We are delivering cleaning kits containing masks, liquid soap, disinfectant, and 5 liters of water to 300 rural families. We are also distributing vegetable seeds, including carrot, spinach, chard, beets, and lettuce, to 300 rural families to ensure their access to fresh food in the coming months. Nicaragua's government has largely sidestepped international guidelines to mitigate and control rates of COVID-19. There's also limited transparency in the reporting of cases and deaths, which has led many in the global health community to believe they are underreporting cases. There has been no national order to shelter in place, and many large-scale events are still being held. Meanwhile, Esperança is working to prepare rural families and prevent the spread as much as possible through a variety of public health efforts. First, we have installed new modern toilets in 20 homes in Jinotega that were previously sharing one latrine in terrible condition. We are also distributing regular deliveries of medication for 300 individuals with chronic disease, relieving economic stress and ensuring they continue their prescribed regimens for the months to come. Finally, we are distributing seeds, providing grain storage and technical assistance to 50 rural farmers in the dry corridor of Jinotega. Though COVID-19 has yet to reach the community of Masi in Mozambique, where Esperança serves, families are in fear because many of the relatives are to return from neighboring South Africa, which has closed its borders to foreigners. One positive result of the pandemic is that community members are more interested in engaging in ongoing hygiene education workshops provided by local Esperança health activists. We have taken the following steps to support these efforts. All our health education includes a COVID-19 component that teaches families about the risks and ways to prevent infection. We are encouraging and implementing hand washing and hygiene practices for the 300 members of the community, including adding a hand washing station at the entrance of each home. Guayaquil was the epicenter of the COVID-19 outbreak in South America when it first hit the continent. The city faced a brutal outbreak of the virus that left hospitals overwhelmed and authorities struggling to collect the bodies of presumed COVID-19 victims. One such hospital was Esperança's partner, Hospital León Becerra de Guayaquil. In response to the outbreak, Esperança has supplied the hospital with PPE biosecurity suits, protective glasses, Vicron, and N95 masks for their frontline health workers. The common thread we are addressing among all our programs, besides hygiene, is food security. In conversations with our partners, it has become clear that the next pandemic our communities could face is insufficient food and hunger. The UN recently released a report stating that an additional 130 million people could be on the brink of starvation by the end of 2020 as a result of the outbreak and its economic ramifications. This could become a reality in many of the communities we serve, which is why we are working to bolster them with additional seeds, tools, and technical assistance to prepare for the challenging times. Esperança will continue to work with our community partners to address their most pressing needs, especially during these critical times. Thank you.